Wichita Liberty TV, featuring host Bob Weeks. Local politics without the spin. Interviews with nationally respected economists. Hear directly from Kansas conservatives about what matters to you. It's individual liberty, limited government, and free markets. Wichita Liberty TV.
Hello, I'm Bob Weeks for Wichita Liberty TV, your weekly source for news, analysis, commentary about Kansas and Wichita government and public affairs. We're broadcast on Great Plains Television, that's channel 26.1, broadcast Sunday morning at 8:30, repeated at 4:30 in the afternoon. You can also find all these episodes at The Voice for Liberty, that's my blog on the internet at wichitaliberty.org. Every episode of Wichita Liberty TV is there, show notes, and also lots of the other information I and others produce is there at wichitaliberty.org as well. Karl Peterjohn, co-host. Been a while since we were here by ourselves without a guest, and just remind our viewers, some of the great guests we've had, we've been really fortunate. Fred Smith of the Competitive Enterprise Institute last week. The week before that, Ben Jones of Equal Justice USA on his thoughts on the death penalty. Before that, attorney Keen Umber of talking about criminal justice issues. Sean Sullivan, the Kansas State Budget Director. James Franco of Kansas Policy Institute. I think we talked a lot about education on that episode. And before that, James Otteson of the Center for the Study of Capitalism at Wake Forest University. And so all that's at wichitaliberty.org. There's a link right across the top that says Wichita Liberty TV. You can find all these episodes and others. So, Karl, thanks for joining me this year. I think it's we've had a good run so far.
This week.
Yeah. Well, this year, because it was right after January that you joined as co-host.
Well, it's been a lot of fun, and we've had some great guests. I think the important thing that we are able to get some information out to the public that is unique, that the viewers would not be able to pick up anywhere else in the local media market.
Yeah, well, that's why just duplicate what the Wichita Eagle or Cake TV does. We'll do something different. But anyway, we can now turn our focus to local and state affairs. And one of the probably big issues that's been percolating in Kansas for the past couple of years and really came to a head just this week in Kansas is the idea of Medicaid expansion. So Medicaid is, of course, a mixture of federal and state funding, but it is health care for low-income people, not Medicare, which is for senior citizens, us basically, but Medicaid for lower-income people, and expanding Medicaid throughout the states, in other words, raising the threshold of income under which people will qualify. That was really a big part of Obamacare. But what happened in Kansas?
Well, basically, when the U.S. Supreme Court ruled that each state had the ability to determine whether they would participate in the Medicaid expansion under Obamacare or not, Kansas became one of the 19 states that did not go forward with that, and most of the states had this resolved several years ago. But for whatever reason, this has been an issue that came up in the 2017 Kansas legislature, and with the attempt to override the governor's veto of this expansion.
Both the House passed it, I think, at the end of February. The Senate passed it just last week, I think.
Well, both houses had passed it. It went to Governor Brownback. He vetoed the legislation, but the House was unable to override the governor's veto. So the legislation, for the moment, is dead. But the old joke in Topeka is that if you're going to have health problems and die, the best place, more things have been brought back to life at the Kansas State House than any other place in the state, including every hospital in Kansas.
Yeah. Seems, though, kind of unlikely that this will happen, because I know there was intense pressure on members of the House of Representatives to vote against the governor's veto, and they did fall 3 votes short. I think you need 84 votes to override. There were 81 votes to override. So that seems like only 3. That should be easy to flip, but I know that there was intense pressure on everybody to flip, so I don't know what they can do anything else.
Well, issues like this, the legislation that was brought in can be brought back, and whether it's in another bill or they resurrect this bill, that gets into the legislative weeds, and I'll stay out of that for the moment. But the bottom line is that this can be brought up again if not this year, then certainly next year.
Right.
And the whole issue of where Obamacare is going, it's a nationwide situation, and it's interesting. Some of the states surrounding Kansas, including our neighbor to the east, Missouri, they have some counties in their state where they are down literally to having 0 providers under Obamacare. And there are a number of states where this is starting to occur. And so when they say that Obamacare is imploding, this is a real sign of that. And so this calls into question the idea of doing any expansion under Medicare. It raises a big question mark, I think, for anyone who looks at this issue in any detail.
Yeah, and a couple, maybe 3 weeks ago by now, of course, President Trump and Speaker Paul Ryan had a bill to, some people say it canceled Obamacare, some people called it Obamacare Light, whatever it was, it didn't work. It didn't make it through the House of Representatives. So Obamacare is the law of land right at the moment, but they're still working on it, and who knows by summer, fall, next spring what the law is going to be. So we do have to take that uncertainty into account. Karl, this is an important topic, so we're going to keep on this after we come back for a commercial break. We'll be back in just a moment. Well, welcome back to Wichita Liberty TV. I'm Bob Weeks with Karl Peterjohn. So, talking about Medicaid in Kansas, under Obamacare Medicaid expansion, the federal government would pay 100%, I think it's down to 90%, of the cost of the states in doing the expansion. And that seems to be a pretty powerful argument that proponents of expansion use, that by now they estimate $1.8 billion, they say is sitting somewhere in Washington that we could have had if we had expanded Medicaid. But that seems like a powerful argument.
Well, whenever you throw out a figure and says this is money available that you left in Washington, I would say that, frankly, that money is not sitting in Washington. And with the federal deficits that are running, we've roughly doubled the federal debt during the last 8 years that's on the books, and the off-the-books debt, which a large part of the programs, whether it's Medicaid, Medicare, or any of the Social Security, is off the books. And so when they say the federal debt is around $20 trillion, and that's roughly double what it was in 2008, we're in a situation where you're not counting a large part of the total debt that's there. But the proponents have been basically saying that because of the costs and the way the health insurance industry is moving, we needed to do this expansion. And of course the hospitals, the argument's been made that the smaller hospitals, a lot of them county run, have been hurt, but they've been hurt in the sense that if they had Medicaid payments and their patients were under Medicaid, they'd receive more compensation than they're receiving now.
And there were, like, I think over 100 endorsers of Medicaid expansion, medical associations all over the place. And you think, okay, well, these people just have our health in mind, but they do, I'm sure, but they are a special interest group just like anybody else. They want more spending on health and medicine and so forth. Some of it would undoubtedly do some good, but others would not. It's just spending to them.
Well, there's been arguments in terms of how well the Medicaid program has worked, and unfortunately it's had a long history. When it was created in the 1960s as part of Lyndon Johnson's Great Society programs, we've far outgrown the anticipated costs that were initially budgeted and expected. That's one problem. The second problem has been it has been a classic source of what's called waste, fraud, and abuse in terms of misuse of the programs and people taking advantage of it. And there's been a lot of folks who end up getting indicted for Medicaid fraud, and also Medicare fraud too.
And well, in Social Security, all these government programs, like private business too, are open to fraud and so forth. But This really kind of cleaves a little bit between government and capitalism. For example, the proponents of more government health care, and of course there's things like the public option, which is basically Medicare or Medicaid for everyone, something like that. They say Medicaid and Medicare are efficiently run. Their overhead administrative costs are like only 1 or 2% or something like that, while private health insurance, Blue Cross, all these Anthem, all these big companies we hear about, they've got a CEO who makes $5 million a year, and they've got to earn a profit, et cetera, et cetera. But on the other hand, they don't realize that one of the reasons why Medicare and Medicaid are run so inexpensively is they pretty much pay any bill that's shown up to them.
Well, that has been one of the challenges, because if we're going to go to a socialized, what they call either single payer, and we can put whatever label on it, Bob, the bottom line is that if you don't have a price mechanism for allocating resources, if you basically say the marginal cost for a user is zero, you're going to have almost infinite demand. And so your costs are going to bust the budgets, which is what's happened with these programs for the people who are eligible. Going forward, the argument's made, well, with our current programs, we're spending a good deal more than a lot of other countries that have done the full socialized medicine model, but they have long waiting lines. People don't get treatment. There's regular stories about people dying waiting for basically sometimes routine, what we'd consider routine medical care.
Yeah, and plus I think that doesn't take into account that America is not the only source of innovation in medicine, but we do a lot of it, and that innovation is expensive. How much does it cost to bring a new drug to market? It's in the hundreds of millions or something like that. Very expensive to do that. We shoulder those costs. We develop those drugs, and then it turns out often that the cost to manufacture them is very simple. Many of them are just chemicals. I mean, they're made like in an oil refinery or something, not quite that, but then they can be sold very inexpensively in other countries, but still someone had to front the risk and the cost of the initial development.
Well, that's been getting into a much broader issue in terms of patents and intellectual property, and that would take us a long way from Medicaid, Bob, but it is a significant part of the cost of innovation within medical care and treatment. And where would we be today without the innovations that I can think of that have occurred just within our lifetimes?
Exactly right. So, Karl, let's take another moment off. When we continue, we'll be talking about more statewide issues. Welcome back to Wichita Liberty TV. I'm Bob Weeks, again with Karl Peterjohn. Not to hammer on this Medicaid topic too much, but one of the things we found is that Medicaid just doesn't produce very good results. There was a study in Oregon, and Oregon produced a rather, well, I think it's totally unique example of a controlled randomized experiment where for some reason they had enough money to offer Medicaid to about 10,000 additional people. That's more than what wanted it, so they had a lottery, which is a random assignment of treatments to a population. So what did they find? They found that Medicaid spending increased, but the health impact, the health results of these people did not increase, the people that got the Medicaid compared to the others. And what really got me is that, another argument that these Medicaid expansion promoters make is that, right now when people get sick, they go to the emergency room. That's the most expensive way to treat people. If they had Medicaid and could go to the regular doctor on a regularly scheduled office visit, that's much less expensive. But what the Oregon study found is that the Medicaid enrollees they went to doctors, but they also went to the emergency room even more than they used to in the past. And the study authors thought, okay, maybe they're just getting used to doctors and not using the emergency room. But a couple years later, they found that it still persisted at this effect, that they still use the emergency room in very high numbers.
Well, if you have a situation where you're not picking up part of the cost, or your marginal cost is zero or close to zero, your behavior won't change, and it will be whatever's most easy or convenient for you as opposed to what makes sense.
That's just really really baffling. That you know, the thing that they tell us, this is why we need it. Well, they did an experiment and it didn't turn out to be true at all. You know, another thing is there's a poll going around commissioned by the American Cancer Center that says 82% of Kansans want Medicaid expansion. Now, I've asked for that poll, and usually most organizations, if they conduct a public policy poll that they are using to advocate for some issue, they will publish the entire poll. Last February, a year ago, the Hospital Association did a similar poll, and yes, they did. They released the whole transcript of the questions and the
Sample
answers.
sizes?
Pardon me?
The sample sizes too?
Yes, everything. I mean, it was
Okay.
everything that you would need to know, including the text of the questions. And one of the questions was kind of a little bit tricky. It says, well, now if I told you that the Medicaid expansion would be revenue neutral to the Kansas budget, would you be in favor of that? And the number went way up. I think that's what happened to this American Cancer Society study that's being used this year, but they will not release. They released part of a question to me, but they will simply not put the poll out there like a reputable organization would and should.
Well, we've had fake news. Why not fake polls?
Well, yeah, and I'm not saying that they faked it, but they may have asked.
But Bob, if you ask the question the right way,
Mm-hmm.
you can get what you view as the right answer.
Well, exactly right.
And then if you won't share what the question is, and if you won't share, for instance, key parameters like, for instance, sample size, details in terms of the questions, because if you word a question in a vague or subjective way that would allow people to misconstrue what you're asking, you can obviously get different, you can drive the poll numbers, and it becomes what in the political world they call a push poll.
So I have no doubt that 82% of people did say yes to something, but we don't know what that something was. So it's really, I don't think, something that we can use to base public policy on. And speaking of, last week, the Kansas Center for Economic Growth, that's a think tank that definitely promotes more taxation, more spending, things like that. They released a poll that said, like, oh, I can't remember the number now, but like 80% of Kansans are concerned about spending on schools. So I looked at the poll. They did release the questions and everything like that. And that is just it. They said, are you concerned about the level of spending on schools in Kansas?
I'm surprised it's not 100%, Bob.
Yeah, because I'm concerned that we're spending too much about that. And other people are going to be concerned we're not spending enough. But the question, as vague as it was, you know, anybody who knows we spend a lot of money on schools ought to be concerned that we're spending it wisely or anything like that. This question simply, I don't think, can be used to draw any conclusions.
Well, unfortunately, if you, there's a computer phrase, garbage in, garbage out, and if you really don't define exactly what you're trying to identify and what you're trying to get information on, you can end up in a situation where you get information that really isn't very helpful or useful.
Well, at least kudos to KCEG for releasing that poll so we can look if we want. And I do have to say, our friends at Kansas Policy Institute, they do quite a bit of polling and surveying, and they do release the questions, the crosstab results and everything. So people can see exactly what the questions are being asked and how people are responding. So, Karl, we're getting down to the wire here. We'll have one more segment of Wichita Liberty TV in just a moment. Welcome back to this last segment of Wichita Liberty TV for today. I'm Bob Weeks with Karl Peterjohn. So, Karl, there's been some action at the Sedgwick County Courthouse with the Commission over the past month or so. One was that the county, this is where things always get confusing. The county had passed a resolution, I think the year ago, saying that we want to lower the mill levy starting in several years. I can't remember the exact year. And then there was a proposal for an ordinance that says the same thing, except it struck out the lowering of it. And our friend Commissioner Richard Ranzau was opposed to that. He wanted the tax rate, the mill levy, to go down. So the commission did agree 5-0 to scrap that that proposed amendment, ordinance, whatever. So it is the policy of the county commission that this mill levy, the property tax rate, will go down. So was that a tax increase or a tax? What was that, Karl?
Well, since it isn't going to show up on your tax bill this year, it was basically an indicator of where the county commission was pushing county fiscal policy for staff as they prepare the 2018 budget that will be approved this summer, take effect starting January 1 next year, and for the years going forward, Bob. The challenge that elected officials have is that government, the joke has been among elected officials, is the short term is the news cycle and the long term is the next election cycle. So nobody's really looking more than, at the county level, there were 4-year terms, no more than 4 years out. But we had been trying to draw down county debt when I had the privilege of serving on the commission, particularly during the last 2 years, with the hope that we could return a significant portion of that money to the people who earned it, the taxpayers, and drive the mill levy down. We could continue to do and provide necessary county services, because there's 2,700 full-time county employees out there, whether it's EMS, 911, the courts, the county courts, the Register of Deeds, treasurer, all those functions rely on people's primarily county property tax funding to pay for them. And the hope had been that if we could draw down some of the debt that had been put in place, we could return some of that money to the taxpayers. And there was a discussion about whether the majority of this commission would change that policy that had been put in place about a year ago.
And these things get very confusing. Here's about the simplest example I can think of. Was it 2009 that Governor Mark Parkinson of Kansas said, let's have a 1-cent sales tax for 3 years to get the state budget through a tough time? And that was, the recession years. So, perhaps a lot of people, well, they did agree to it. The legislature passed the bill. But then what happened in 3 years? Well, the sales tax, the 1 cent, was scheduled to go off, but what happened was it only went down half a cent, not 1 whole cent, half a cent, I think, in round terms. So was that a tax increase or a tax deal? It depends on, I guess, which side of the pond you're fishing from, really.
Yeah, well, it really does, but that wasn't the first time. Back when Governor Sebelius was in office, they had scheduled and had a sales tax increase that was scheduled to step down, and that was basically set aside and said, no, we'll keep the current rate. And of course the argument was, well, it's not an increase because the rate's not going up, but it had been projected to go down. And that's why when Sedgwick County, and I thought it was fairly remarkably, when the voters had voted for the sales tax for the downtown arena in 2004, that was set for 2.5 years. And when it went off, that sales tax at the local level here in Sedgwick County did go down 1 cent, but in a lot of other cases that's been the exception and not the rule.
And I do remember Commissioner Tim Norton wondering out loud, gee, if we kept that tax, think of all the things we could do. I mean, and we see this at the state level, that politicians have an unquenchable appetite for spending. This year, we need to, very difficult to ratchet down any spending. Always the urge is more taxes. That money gets spent right away, and then more taxes the next year, it seems.
Well, 1 cent here in Sedgwick County would generate a little over $80 million a year. And to put a little context to it, Bob, if you had about a 1.5 cent sales tax, which would generate ballpark around $125 million current rates here in Sedgwick County, the county's mill levy is about 29 mills, which would generate very close to that amount, give or take a couple $1 million. And so you could, in theory, eliminate the county's mill levy if you'd had a sales tax that was just 50% larger than what we had for 2.5 years for the downtown arena. But Commissioner Norton's absolutely right. in terms of there's an awful lot of spending that can occur. If you've got an extra $80 million, that would be about a 20% increase in county, a little less than 20% increase in county spending.
Well, fortunately, the tax for the arena did sunset as scheduled, and now we do have the arena, for better or worse. But when the city of Wichita a couple years ago tried the 1-cent sales tax, voters rejected that pretty soundly. So maybe that's a topic for some other day. But anyway, we're out of time. So Karl, thanks very much for appearing this week. Another episode of Wichita Liberty TV. I'm Bob Weeks. We'll be back again next week.